Like, that's a great lateral distraction. Now can you give me an actual hip distraction? Thank you, because it's a long perpendicular to the joint plane. If I ask you, can you show me an inferior glide? Can you show me a superior glide? Well, no, I would jam it into the hip. I'm like, well, not a long axis superior glide, an actual joint superior glide. This way. So superior glide, inferior glide, a joint distraction. And you can do lateral distraction, you can do long axis distraction. Posterior glide, you're going to glide down a little bit. Anterior glide, you might come up a little bit. But just think about the orientation of the hip itself, and that's going to help you when you go through the mobs here. So, if the patient weighs enough and the hip's small enough, just the weight of their body is going to stabilize their pelvis for me. But if it doesn't, I can just take a belt and put it here over the ASAS and compress them to the table. That's really going to be a lot easier for me, because then I can test mobility. I can slide her over and test it again. If I have 3 belts on her on this side, I have to take them off, scoot her over, retest, test again. Oh, wait, let me come back here. I'm not really sure. It's just not practical. It doesn't make sense to me. It never will. Nobody's going to talk me into that. Anyway, so what's the resting position of the hip? So just think of this as a big, fat shoulder. I get her in the neutral position. Usually I use a couple towels here just for cushioning because I'm digging the adductors. I will adduct them out, slide up and in as close to the hip joint as I can. If it's guys, I tell them, move your monkey junk out of my way, or it will get pinched. And so adduct, get in there, get as close to the leg as I can. Sorry, I'm spitting. I'm just so excited. You can keep the foot on the side, or if the leg's too heavy and you can't control it or they're not comfortable, what you do is you let the leg hang off the table here, and this is where you use a belt, the Rambo belt, around your shoulder and around their leg to actually support the weight of their leg. So sometimes this is going to be a whole lot easier if the weight of their leg supported, you can focus here. But I want to check my mobility. Ah, itchy, itchy, itchy. Superior glide. Just shift my body. There, inferior glide. See now her, see how she's moving? So I probably want to belt her down. I'm getting too much accessory motion. There's my inferior glide. There's my superior glide. This hurts you with my thumbs. There's my posterior glide. There's my anterior glide. I'll block here. There's my distraction. I've tested her hip mobility. If I want to test it at 90 degrees, well, I can just do it like this. I can put it over my shoulder if I want, but not for testing. It's just not practical. Here's inferior glide at neutral. Here's inferior glide at 90. You know, it's like, it's just easy for me to move like that. Now, I should put a belt around this, and then I can really focus on her hip. I don't have to, and I probably want to push her down because, you see, I'm wiggling the pelvis a little bit, so I want to stabilize that. If she was bigger, then maybe the body weight. Most guys, the body weight's enough. You can move that hip, and you're actually at the in range before their body starts moving. So that's my bias on it. Then I'm like, well, it seemed tight, but I have no idea. Let me switch it to the other side. So you mind switching over there? Have you scoot to this side? So you're just doing the same thing. You take the shoulder, take it around the clock. Do the same thing with the hip. Take the leg, take it off, get down as close as you can. Here's your superior glide. Here's your inferior glide. Or you can come up here just like I do with the shoulder. Posterior glide. Anterior glide's kind of tough. You know, the shoulder's tough. The hip's almost impossible. Kind of check different quadrants, different angles, and just get an idea how well the hip moves. So you just think of it just like what you're doing with the shoulder. You just need to think of your directions. If she was belted down or belted across, I can do my lateral distraction a lot better for treatment. But just for testing, probably compressing down is good. If they're heavy enough, I can just get in there and feel that. Make sense?